Gout is a form of inflammatory arthritis that occurs when excess uric acid builds up in the bloodstream and forms crystals in the joints. These uric acid crystals can cause sudden and severe episodes of pain, swelling, redness, and tenderness in the affected joints. The condition primarily affects the joints, most commonly the big toe, but it can also affect other joints such as the ankle, knee, foot, hand, wrist, or elbow. Diagnosis: Gout is typically diagnosed through a combination of patient history, physical examination, and laboratory tests. Joint fluid analysis may be performed to check for the presence of uric acid crystals in the affected joint, confirming the diagnosis. The symptoms of gout primarily involve sudden and severe attacks of pain, swelling, redness, warmth, and tenderness in the affected joints. The condition often develops rapidly and can be quite intense. Gout typically affects one joint at a time, most commonly the big toe, but it can also occur in other joints, such as the ankle, knee, foot, hand, wrist, or elbow. Here are the key symptoms of gout. Acute joint pain. Gout attacks usually begin with a sudden onset of intense pain in the affected joint. The pain is often described as throbbing, excruciating, and unbearable. It can be so severe that even the slightest touch or pressure on the joint becomes extremely painful. Swelling. Along with pain, the affected joint will likely become swollen. The swelling can be significant and cause visible enlargement of the joint. Redness. The skin over the affected joint may appear red or purplish. The redness is a result of the inflammatory response to the uric acid crystals that have accumulated in the joint. Warmth. The affected joint may feel warm to the touch due to the inflammation caused by the presence of uric acid crystals. Tenderness. Gout-affected joints are highly sensitive, and even the slightest pressure can cause extreme tenderness and discomfort. Limited range of motion. During a gout attack, the joint's range of motion may be limited due to pain and swelling. Recurrent attacks. After the initial gout attack, there may be periods of remission where the symptoms subside. However, if the underlying causes of gout are not addressed, further attacks are likely to occur. The primary cause of gout is an excess of uric acid in the bloodstream, a condition known as hyperuricemia. Uric acid is a natural waste product that forms when the body breaks down purines, which are compounds found in certain foods and beverages. In individuals with gout, either the body produces too much uric acid or it is unable to eliminate it efficiently, leading to the formation of uric acid crystals in the joints. Several factors can contribute to the development of hyperuricemia and gout. Diet. Consuming foods high in purines can increase uric acid levels. Foods that are particularly rich in purines include red meat, organ meats, liver, kidneys, etc., certain seafood, such as anchovies, sardines, mussels, and some types of alcohol, especially beer. Alcohol consumption. Alcohol, especially beer, can interfere with the excretion of uric acid from the body, leading to elevated levels and an increased risk of gout. Obesity. Being overweight or obese is associated with higher uric acid levels. Additionally, excess weight can contribute to insulin resistance, which may reduce the excretion of uric acid by the kidneys. Genetics. Gout can run in families, indicating a genetic component in some cases. Certain genetic variations may make some individuals more susceptible to hyperuricemia and gout. Medical conditions. Certain medical conditions can increase the risk of gout. These include kidney disease or conditions that affect kidney function, such as diabetes and high blood pressure. Medications. Some medications can interfere with uric acid excretion or increase its production, raising the risk of gout. Examples include diuretics, water pills, and low-dose aspirin. Dehydration. Insufficient fluid intake can lead to higher concentrations of uric acid in the blood and increase the risk of gout. The treatment of gout aims to manage pain during acute attacks, reduce inflammation, lower uric acid levels in the blood to prevent future attacks, and prevent complications associated with chronic gout, such as joint damage and tophi formation. The treatment approach typically includes a combination of lifestyle changes and medications. Here are the main aspects of gout treatment. Lifestyle changes. Dietary modifications. Reduce or avoid foods high in purines, such as red meat, organ meats, seafood, and certain alcoholic beverages, especially beer. Instead, focus on a balanced diet with plenty of fruits, vegetables, whole grains, and low-fat dairy products. Weight management. If you are overweight, losing weight can help lower uric acid levels and reduce the risk of gout attacks. Hydration. Staying well hydrated can help flush out excess uric acid from the body. Limit alcohol. Limit or avoid alcohol consumption, particularly beer and spirits, as they can raise uric acid levels. Exercise. Regular physical activity can help maintain a healthy weight and improve overall health. Medications. Non-steroidal anti-inflammatory drugs, NSAIDs. These medications, such as ibuprofen or naproxen, are commonly used to relieve pain and reduce inflammation during acute gout attacks. Colchicine. Colchicine is an alternative anti-inflammatory medication used to treat acute gout attacks, particularly for those who cannot tolerate NSAIDs. Corticosteroids. For individuals who cannot take NSAIDs or colchicine, corticosteroids, either oral or injected into the affected joint, may be used to reduce inflammation and relieve pain. Xanthine oxidase inhibitors. Drugs like allopurinol and febuxostat help reduce uric acid production by inhibiting the enzyme xanthine oxidase. They are often used for long-term management to prevent future gout attacks. Uricosurics. Medications like probenecid can enhance the excretion of uric acid by the kidneys, thereby lowering uric acid levels in the blood. Pegloticase. This medication is reserved for severe, refractory cases of gout. It works by converting uric acid into a more soluble form that the body can eliminate more easily.